some of the basics, the concepts, the rationale behind a type of exercise which you call respiratory exercise. What is exercise? Giving training. What do you train? You train your body, your physique. You call it physical exercise. And sometimes you give an exercise to your mind also. So, physical exercise, you move your organs and you train your organs and parts of your body. And when you give exercise to your mind, you train your mind to focus, to concentrate. In fact, thinking about nothing itself is a sort of exercise you give it to your mind, brain. Of course, brain and mind are different. So when I say training, you train your body, a physical exercise, to do more, to do a particular thing for a longer time without getting tired. Is there anything called respiratory training? Already you are breathing, you are taking in and out air, you are doing it. Then, what is the meaning of respiratory exercise? When I say respiration, it is about oxygen. The air you breathe in and the oxygen in the air, which is absorbed into the blood when it is in the lungs. So now the exercise here means you increase the volume of air breathed in. And second thing, you hold the breath for longer time after inhaling the air. So inhaling more air and keeping it inside for more time or longer time is a sort of respiratory exercise. In fact, this is the main basis of respiratory exercise. Then, what is the purpose of doing this? So you are at rest, you are sitting and you are working. At that time, your requirement for oxygen is less. The quantity of air which you are breathing in is sufficient to meet that demand because you are not doing a physical work, but you are sitting and you are resting. At the same time, when a situation arises where you have to run or walk or do more work or climb stairs, at that time your requirement suddenly increases. Your lung is not trained to face that situation. So naturally, you feel difficulty in breathing. You call it breathlessness. Why? Because the oxygen, the air demand is more when you do a strenuous work or when you face a threat even. You want to run or you want to face the situation and fight back. Even at that time, your requirement increases. More air is needed, more oxygen is needed, which you are not used to. You have not trained your lungs like this. So at that time, you feel breathlessness and you are not able to face that threat. So finally, the organs inside your body needs more oxygen. So you have to do this breathing exercise to meet the demand. Okay, fine. We have given enough training to your lungs. Where does this oxygen go? Enters the blood. Where does the blood go? To the heart. What does the heart do? It pumps blood to all the organs. So the demand is for the organs. The pumping organ is the heart, and you have a well-trained lungs, and the lungs supplies enough air. In case if the heart is not able to pump more blood, what I say is if the heart is weak, then there's no use in doing a breathing exercise. So you have to train both simultaneously, your heart and your lung. Then only the demand will be met. So breathlessness may be due to an untrained lung or an untrained heart. So both are linked. So you have to train your lungs and heart simultaneously. Of course, the other causes may be there. The blood which is carrying the oxygen, it may be at fault. For example, anemia. The number of cells is less, the hemoglobin may be less. Even that time, whatever exercise you give to your lung, you will have breathlessness because the oxygen carrying capacity of the blood is less. So as I told, there is nothing called exclusive respiratory exercise. When you do a respiratory exercise, indirectly, you are giving an exercise to the heart also. So what is this actually? You are training your lungs and your heart to do more work with less effort. This is what the concept of exercise, cardiorespiratory. Your respiratory rate should not increase, but you should take more air. Your heart rate should not increase. At the same time, the heart should pump more blood. When you train in this way, more air with a less respiratory rate, more blood is pumped with a less heart rate. So, less respiratory rate, you will not have breathlessness. Less heart rate or a normal heart rate, you will not have palpitation. So, you have to meet the demand without breathlessness, without palpitation. For that, you are training your lungs and heart, and this is called a cardiorespiratory exercise. So, what you are doing at rest is reality. What you can do when a demand is there, that is your capacity. The concept of exercise is from reality, you go to your capacity. Use your capacity to meet the demand because it is possible provided you give a training to your organs like lungs and heart. But at rest, the demand is met. When a crisis comes, when a threat comes, your demand is more. So, cardiorespiratory means you are training your lungs and heart to meet an emergency, a threat, either to fight back or to run away from that place. At that time, you should not feel tired. I will give an example. Suppose a dog is chasing you. Will you run the same way when you are doing a normal exercise? No. You will try to run fast and you have to run a long distance also. So, a fast running and a distant running, you are not used to that. Now you get palpitation. Now you get breathlessness. You escape from the threat. Or you want to face and you want to fight with a dog. At that time also, you need more energy, more oxygen, and more blood supply to fight. This situation you are not used to, but you can do. That you can do is your capacity. The purpose of exercise, the concept of exercise is even if there is no threat, imagine you have a threat and train your lungs and train your heart so that when a real threat comes, you will have the confidence of facing that threat. You can run away very easily because you are trained. You can fight back because you are trained. This is the concept behind training your lungs and heart. From reality, you go to your capacity. Well, the next point is, of course, you are trained your lungs and you are trained your heart. Cardiorespiratory exercise is okay. But you want to run. At that time, what comes there? The muscles. So now you have to train the muscles also. When you run, the muscles contract and relax. The muscle needs more blood supply. The muscle needs more oxygen. So now what you should do, take more oxygen, pump more blood, and make the muscle use all these things, run without tiredness. So now you are training your muscles also. When you combine these three, the respiration, the heart, the pumping of blood, and the muscle without pain and without tiredness or weakness, these three, you call this as an endurance exercise. Respiratory endurance, cardiac endurance, and muscular endurance. You have to do, the time factor comes. You call that endurance exercise. So you need more air, but you should not increase the respiratory rate. You need more blood, you should not increase the heart rate. And you have to run for a longer time, the muscles should not get tired. Supply of more oxygen, pumping of more blood to the working muscle for a longer time with less effort. That is called cardiorespiratory exercise. Now the biggest question comes. I said giving an exercise to your lungs is using the capacity. When I said respiratory exercise, I said you take in more air and hold it inside for a longer time, and by this you are giving exercise to the lungs. But remember, even if you are not doing, some air is going in and some air is coming out without your knowledge. You don't feel that you are breathing, but when you really feel that you are breathing, then there is a breathing problem. because it is an involuntary act, not under your control. The same thing is heart. The heart is beating. Do you feel that heart beating? No. You don't know it is pumping blood. It's going on from birth. But when you feel that the heart is beating, you call it palpitation. So both are involuntary act, respiration and heart contraction relaxation. To some extent, you can control your breathing, so it becomes a voluntary control. So respiration, you have involuntary part and voluntary part, but heart is not like that. Or you cannot stop the heart for some time. It is beyond your capacity. Then how you can do a cardio exercise? Simple. I told both are linked. When you train the lungs directly, taking more air and keeping in for long, now the heart will accept and adjust this and absorb this excess oxygen, and the heart will try to pump more blood without any difficulty or with less effort. What I mean to say is, without increasing the heart rate, the heart will pump more blood to all the organs. So more oxygen is there, more blood should be pumped without increasing the heart rate. This is a concept of cardiorespiratory exercise. Well, how this is achieved? What is reality and what is your capacity? In reality, what happens during respiration? And in reality, what happens to the pumping of the heart? After all, we have only 5 liters of blood. 5 liters goes to all the organs and come back to our heart. There is something called cardiac reserve. That means that is what is called the capacity. The heart can pump 25 to 30, 40, 50 liters of blood. That is its capacity in 1 minute. A trained athlete can pump even 50 liters of blood in 1 minute. That is what training, which you and I cannot do that, isn't it? Because we can do that, of course, if we are trained. An athlete is trained only to do this. Without breathlessness, he should get more oxygen. Without palpitation, the heart should pump more blood. The muscles should work without any tiredness. So this, when it is trained, he becomes the winner of a race, an athlete. Shall we see in the next video what is reality and what is capacities? What is going on in the lungs and heart at rest, and what is going on to compensate this demand during an exercise or a crisis or a threat? We'll see in the next video. Thank you. I am Dr. Balasubramanian.